Well, I feel like this is a great transition because we were talking about pain, and we could talk a little bit about how acupuncture helps with musculoskeletal pain and your other bodywork treatments as well. But before we go there, I'm thinking that some people may end up watching this who've never had acupuncture before, and they may be wondering about the needles. They may be wondering, are they going to hurt? And in my experience, before I came to you, the other practitioners I went to said you shouldn't feel them at all. And then you said that I should feel them a little bit and be aware because it's moving energy. So talk about the needles, reassure people, and then what should we feel and what should we not feel?
Great question and great topic to talk about, because that's one of the biggest concerns for most people and one of the biggest hurdles for them even coming in for a treatment. So I'm always very clear to talk about that with people to reassure them. So one of the first things to know is that an acupuncture needle is rounded at the tip, more like a sewing needle. A Western needle is angled at the tip and hollow because it's trying to purposely cut the skin to put or pull fluids from the body, medicine or blood.
Oh, wow.
So
I never thought about it.
The structure of the needle itself is completely different.
It's not hollow.
It's not hollow,
They're
it's
just
completely
little...
solid metallic needles, stainless steel. Mm-hmm. And so in addition to the rounded tip, which makes it a smooth entry, and for a lot of people, they don't even know what's gone in. They're like, oh, did it go in?
Mm-hmm. And
then we have different, what we call gauges, just like a Western needle, different sizes and thicknesses and lengths. And so if somebody's extremely reactive, and especially if they've had acupuncture before, I will use a thinner gauge for that particular person. But really the thickness or thinness doesn't determine how somebody reacts or how painful or uncomfortable it is. It really is about the person and other factors. So as far as the sensations that I tell people to expect, yes, I try and give as painless an insertion as possible for all of my patients. After that's done, yes, it's the idea and the goal with acupuncture is to interrupt what's happening in the body. There's this dysfunction, this pattern that's happening, and if I just whisper, the body isn't going to respond to me. It's not going to listen. Maybe for somebody who's very sensitive, and I do have some patients that are extremely sensitive, and so I use the thinnest needles, and they respond better to that kind of treatment. If I use my regular gauge needles on that person, they might actually not respond as well or negatively.
I'm just picturing like a flow in a creek or something, like a flow in an aqueduct, and that the needle is going to come in and either block the flow in a certain place or perhaps redirect it into a different avenue or different
I don't know
stream.
if it's something that I had mentioned to you before, but that's actually the exact metaphor of one of the original explanations of acupuncture and how they developed the system in the first place, is that China had one of the most advanced irrigation systems in the world at the time it was developed. And again, we're talking about acupuncture being a language of metaphor, a medicine of metaphor. And so the rivers flowing through the body, the veins, maybe they saw the veins and made that analogy. And so these needles at these certain spots interrupt the flow. So do we need more flow over here, less flow over there?
But it's not interrupting nerve flow or vein flow. It's actually different than that. And we could probably have like a whole separate day on that, right?
A very good question. I think most of the listeners will say, is he affecting the nerves? Or if you have a strong sensation, is it the nerve?
I've wondered that too.
And that's not the goal at all. It's just the muscles. We're helping improve the nerve flow, you could say, by relaxing the muscles.
The needle goes into the muscle.
Correct.
And so if the patient is alarmed, like what should they, like if they feel something too strong, just tell you and you adjust it, or? I've never been alarmed, but.
Yeah, with my patients I always say, now these are the sensations that I consider normal. An achy sensation, that's not an achy, I'm in pain sensation, but just something that you notice. A sense of warmth, or maybe a sense of coolness, or tingling, or maybe you feel it kind of travel up gently or down an area. But I don't want any burning, and I don't want any sharpness to stay there. It might be a little bit of a momentary pinch sometimes.
I'm laughing because it sounds like yoga. Like, I tell people, like, yoga's not always comfortable. Sometimes it's uncomfortable, but that's the discomfort of getting better and healing and stretching and strengthening the muscles, but it's not a scary pain. It's not sharp or hot or tingling or any of that stuff. So
exactly.
Okay,
And I
good.
always adjust the points. I'd say if any of those sensations that I told you aren't what I'm looking for, let me know and I'll adjust the needle. Either I need to just adjust my location, or I just need to do it all together, or adjust the angle.
Yeah. So let's talk about when you would use acupuncture and when you use herbs, and the advantages I don't know if there's any disadvantages of either, but your choices with that.
Certainly. Basically, for most pain conditions, I don't tend to find that I need to use herbs unless it's something really chronic, maybe perhaps a fibromyalgia type of patient that's really depleted. Might need a little extra assist.
Oomph.
Exactly. And then for more internally caused conditions, say a cold or a flu, digestive disorders, acute infections of any kind are very helpful with herbs, and so I often use that as well.
Because the herbs are just medicine.
They're a way to get a treatment every single day.
Right.
And so if you're trying to interrupt the signal that the body is having, or the pathology that's going on in the body, you need something stronger and more regular.
Yeah. Well, let's move on. Let's go, because you and I could talk about all this stuff forever. Let's move on into musculoskeletal pain that usually is happening as we're in the aging process. So it could be back pain, neck pain, and
Arthritis.
Arthritis is a big one, right? So what kind of stories and successes do you have with that?
Well, a common thing that most people will get diagnosed with as they get older is the degenerative disc disease. Most people will hear that after 50, or maybe even at 40 and on. And it's a misnomer because it's not a disease. It's really describing the effects of gravity as we age. So there's less space in the disc as we age if we don't do anything to counteract that. Exactly.
Let's work on our
So if I sit here like this,
Right.
then I'm going to compress my discs if I sit here for an hour or more every day.
Right.
So I
we
do my
both want to sit up
best
straight.
to lean back but have still straight posture.
Yeah.
So it's not as devastating a diagnosis as some people take it.
It's not as dire.
It's not as dire,
Well,
exactly.
I've had so many people that I work with one-on-one for yoga therapy. They bring in their MRI and their x-rays to me, which is great. I love the information, but they'll say on their intake form, I have degenerative disc disease, and I feel the same way. It's not really a disease.
And it's completely curable.
And there's a lot of people who are walking around with it who don't have pain but anyway, that's a whole nother topic. So when someone comes into you with these types of issues, what's your treatment strategy?
Basically to improve the blood flow and to relax the muscles if they're too tight. For older people, there's also the component of strengthening the muscles as well, and so that they would have to do on their own to complement the treatment.
Or with me.
Exactly.
Right.
Get some
We make a lot of referrals.
private yoga instruction. I often recommend either physical therapy or yoga therapy to my patients to continue that process.
But you're using the acupuncture to help the blood flow, and then is that where you'd also be doing body work?
Yes, I do a lot of body work, especially the older my patients are, the more I spend with hands-on and perhaps less time with the needles in. They tend to get stiffer. If they're left too long in one position, and you have pain, you sit too long, you're going to be stiff and uncomfortable. So I try to always give the needles less time and a little bit more hands-on to reinforce what I've done. I do some gentle traction along with just hands-on techniques that I've learned.
Yeah, and just so also might reassure people, the Tuina, is that said? Tuina is with the clothes on. So you can work through a t-shirt or shorts or whatever they're wearing,
Exactly.
Yeah, good. So what else would you look for when someone comes in with musculoskeletal pain?
Basically, I'm looking at the quality of the muscles. So one of the things that I tell all of my patients when they're coming in for pain, despite the age, is that the joints are essentially supported by the muscles, ligaments, and tendons, or these cables. Essentially, they're cables supporting this structure so that there's proper movement. And so, is the muscle flabby? Is there no tone to the muscle? Is it super tight or ropey? And that's going to indicate in part where I'm going to focus my needles. Also, their reaction to certain areas might be completely away from where their pain is, but for me is relevant because that's part of the area that's pulling on that joint. Maybe on the thigh for the low back, for example. A very common thing.
Well, it's like the fascia, the connective tissue, it's all connected. And I tell people a lot of times your toe is connected to your nose. And when I stretch with them, they'll feel, oh yeah, when I move my pinky finger, I feel it in my chest muscle. And it's amazing. I love to work with people on that in that way as well. So I feel like there's a whole nother piece to what we touched on in the earlier video. We were talking about your background, and that not everyone who does acupuncture also does herbs, but not everyone who does acupuncture also does body work, right? That's really a different piece, isn't it?
That's correct. In China, it's very common to incorporate
but here,
in my experience, there are some, certainly. Don't want to say that everybody in my profession doesn't, but it's less common that body work is incorporated into the treatment.
So you're like a triple threat. Instead of singing, dancing, and acting, it's acupuncture, herbs, and body work.
Exactly.
Good.
Along with lifestyle.
And lifestyle, right? Coaching, of course. We all got to do that.